We're going to be talking about opioids, addiction, and overdose. We wanted to bring some awareness to the community about these issues, as we do have people in our community who are currently using. Maybe people aren't aware of what the term opioid means. So would you like to explain that?
Sure. Opioid is a term that's used to talk about as much natural, synthetic, or semi-synthetic narcotics. So in as much as opiates come from poppy, so that would be natural ones would be opium, codeine, for example. Then you've got semi-synthetic, which could be like oxycodone, hydromorphone. And a synthetic would be methadone or fentanyl, for example.
Okay, so just for people tuning in, maybe it would be a little bit easier if we just said painkillers in general. So a lot of people are known to abuse painkillers, whether they're used recreationally or prescribed by a doctor. So we kind of just, maybe we can talk a little bit about that and the differences. So people might have questions as to whether one is more addictive than the other.
In theory, well, opioids are narcotics that are given exactly as painkillers most of the time. You can go for a dental surgery, you can go for or have a broken bone. A lot of the time that's what would be prescribed to be able to alleviate the pain. But it also has a euphoric response. So what can happen, for example, is somebody that's prescribed a medication every 4 to 6 hours and you've been in a lot of pain may take it a little quicker because of the fear of the pain or because of the euphoric response that it gives. So you can start off with a prescription and go towards something else, or go for a stronger medication, or take it more often, which is when it becomes more of a danger. So also, like if you're going towards the street ones, you can buy different kinds of artisanal medications that have been contaminated, which is what we're seeing a lot of right now. Or it used to be a lot of heroin. Well, a lot of heroin. Heroin used to be one of the substances that was offered. We're seeing less and less of it right now because of the pandemic and the fact that the borders are closed.
So would you say street drugs are more dangerous or more potent than prescriptions from a doctor?
I'd say that they're just as dangerous in two different ways, though. In the sense that a prescription from the doctor, if it's abused, if it's taken more often than what's prescribed, if it's not being preserved in a place that's safe and a child can get a hold of, because I may seem like I'm a little bit all over the place because that's part of who I am, but most adolescents, the first drug that they will take is from a pharmacy of a member of their entourage. So the fact of being able to have access to that is a danger, a major danger for children and adolescents. There's also the idea of mixing, because opioids are a depressor of the central nervous system. If you mix with another depressor, which a lot of the time we don't think of, but taking, for example, a prescription medication with alcohol, it's two depressors, which can lead to cardiovascular or
to overdose.
Right, exactly.
Right. Yeah, because a lot of people might not think about it, right? You're taking a medication for your back, which is from the doctor, you assume it's safe, but then you go and you have a glass of wine with dinner, not even thinking that you're putting yourself at risk.
Exactly, exactly. Yeah. And when it comes to street drugs, what the danger would be, obviously, is that the dose, we don't really know what it is, so it's harder to be able to determine. And even if somebody's buying from the same person all the time, it could be a different batch, it could be, it could be contaminated, and not even contaminated with the idea of having a stronger dose. It could be contaminated by cross-contamination, which isn't even intentional, right?
Right. Yeah, because street drugs aren't made by a chemist or a professional person who's knowing what's in every single dose, or knowing that each pill is exactly the same. So I think another problem too is with people who maybe they have a prescription for painkillers and then are offered, offering a painkiller to someone else who says, oh, I have a sore back as well. And the person might be trying to be helpful and say, I have these pain medications. Do you want to try one? I know that's like a lot of people get started that way. So it's really important to make sure your medications are stored safely and that you're not sharing with people that the medication isn't intended for.
Exactly, because it also goes by the weight of the person, their
medical history,
exactly.
and a lot of different factors that a doctor is going to go over to make sure that you're the right person and that that's the right prescription for you. So
exactly.
So what would put somebody at an increased risk for addiction, I guess?
There's a lot of elements. You've got like the psychosocial elements, which could be addiction in the family, right? Because it's a way of, environmentally, it's a way of dealing with things, right? When it's more difficult, it's a go-to, right? So it's a learned behavior in some cases. It can be in as much as the person could have a predisposition. Physiologically, it could be being isolated, right? Because there's not as many resources, not as many people to be able to speak to, so they take it on themselves. It could be, there's so many elements that could lead to, right? It's, I'd venture and say that nobody is immune in the sense of anybody can end up with an addiction.
So we talked a little bit about what can cause addiction, but what are signs to look out for? So say you know somebody's using, what can you look out for to think like, obviously sometimes people really follow what the doctors say, but then there's other people who, you know, maybe they're going to start using and you kind of have a suspicion, like, is there any really telltale signs that would make you know, like, this person is having a problem and what can I do to help them? Or if yourself is using, what can you do to get help?
Okay, well, that would be two different questions. Like, in as much as somebody who has possible addiction issues, a lot of the time the person will isolate. They won't open up as much because there's a lot of shame associated with addiction, right? There's a lot of, I should be able to do this. There's pressure, right? In as much we've got society pressure, but we've also got the pressure we put on ourselves about how we should be able to do this. I mean, not everybody can do everything by themselves. Actually, nobody can.
Yeah.
We'll be honest.
And COVID is making it a lot more difficult, so.
Exactly. So somebody who's isolated, somebody who, they may end up with like financial issues, they may be not going to work, fighting with family members. There could be withdrawal symptoms as well, but that would kind of be secondary. Like you'll notice that the person themselves isn't doing as well. Like you've got, physically, if we're talking opioids, somebody who is using, physically you can see different signs. Like their eyes would be, the pupils of the eyes could be in pinpoints. More shallow breathing, but this is as it's going towards possibility of overdose. But like constipation, there's different elements to do with opioid use. What could somebody do to get help would be to reach out. I know it's really, really difficult. It's not easy to do, but it's to recognize the fact that you can't do it alone, that it's starting to become a problem. It's starting to invade different aspects of your life. Right? Yeah. You've got your spheres that are being cut off for one reason or another, and it's causing different difficulties. It's recognizing the fact that this isn't working for me and I need something different. Yeah.
So who would you recommend reaching out to, like a family doctor or a counselor, calling maybe KSCS here and asking to speak to a support worker or to intake to
all of the above.
File, speak to even like family members and friends. Even you can go online to find resources. There's so many support groups and services available like virtually right now because of pandemic. For people that are having severe symptoms, like for somebody who has really problematic use, and do you recommend them just doing that at home, or is there something else you recommend for those?
No, well, there's definitely different options. Like there's the opiate replacement program, right, which is a possibility. I know that seems very daunting because of the fact that it's replacing one substance for another, but the whole idea behind it is to be able to function, to be able to have the person, to allow them to be able to do what they have to do in a day and not, I know there's still shame associated, but not having to just think of when are they going to get their next dose, how are they going to do it, what do they have to do to be able to get it, right? Because that becomes part of the problem. Is as it becomes an addiction, it becomes overwhelming, and the way of seeing things becomes less and less open, and it's all about that. And it's not with bad intentions, it's just it takes so much place.
Yeah, yeah, because it's not a choice, right? Addiction is not a choice. It's something that overcomes a person and takes over their whole life. So.
Exactly. And other options aren't necessarily seen, even if they're there, right? So it's difficult to be able to put the hand out and say, I need help, but it's super important. So like all of the resources you mentioned, any and all of the above, right? If one door, unfortunately, you don't always get a response right off, keep trying. Keep going to a different, like some family member, they're not able to help you out right off, call your family doctor, try the different things, because it's super important to be able to get the help needed.
Yeah, and it's easier to get help earlier on, right? It's easier to overcome once, you know, if you call early enough and you get that help early enough. Like the longer an addiction has a hold on you, the harder it is to get out of it, right?
Exactly, exactly. And the harder it is for the person to ask for help, but it's also harder to be able to get the services because there are waiting lists, unfortunately, in pretty much every service. Like if we're talking the opiate replacement program, unfortunately there are waiting lists, but it is a help. It is a possibility. So if somebody has addiction, like to go back to your previous question, sorry, I kind of did a detour there. If somebody does have addiction issues and they want to try to get out, I definitely do not recommend trying to do it alone. Definitely not. I mean, because that is just so much pressure, first of all, and physiologically it's so difficult.
Right. So it's really based on the individual and how far along they are in their addiction. So we would recommend maybe calling KSCS and setting up a meeting with an addictions response service worker, and that worker would be able to tailor a program that can help you get out of that state. And if you have a loved one, it can even, you know, give you recommendations and tips on how you can proceed with them. So it's really tailored to the individual. For some people, they might need to be helped by a doctor. They might need medical assistance. For others, it could be a little bit easier, and maybe just, it really depends on the individual. So
it could even be tapering, right? Like once the doctor is aware of what's going on, a lot of the time people who end up with addiction issues, it's, in French we say sournois. It's something that happens without even realizing sometimes, like 4 to 6 hours, oh, okay, well 5, oh, okay, 4.5, oh, 4, like for a prescription, that's, and the person starts to be able to take it, well not to be able, but starts to take it more often, and then the way of using changes, and then, right, because they're still looking for the same effect, but we have something called tolerance,
right,
that our body adjusts to the medication. So the same medication doesn't necessarily have the same effect after a period of time.
Yeah.
And it's normal, it is part of, but the doctor, your doctor who's prescribing, if that's the case, needs to be aware of what's going on so that they can either go for a different kind of medication or they can keep an eye out to be able to help you. And if it becomes an issue, if the pain is no longer an issue, but the addiction has taken over, they can find ways of working with you to be able to taper it off. I'm saying you, but with it, somebody to be able to taper off and to deal with it in a different way.
Well, I think that was some very good information we provided. That was an opening to just opioids and addiction in general, where you can call. You can call KSCS if you have any questions or if you want more information. We also prepare resource kits. So if you have somebody in your life that uses or you yourself use and you would like more information on how to get help, or even just some of the information we talked about today, you can call KSCS and ask for a kit, or you can call KSCS at 450-632-6880 to request a meeting with an ARS worker.